Greetings, and thank you for tuning in to this episode where we delve into a critical topic affecting millions of lives: colon cancer. It's imperative to identify specific symptoms that could be early indicators of a serious health concern. Join me as we explore the 8 crucial symptoms of colon cancer that should never be ignored. Remember, this video is for informational purposes only. Please consult a healthcare professional for personalized advice and guidance. Our exploration commences with a symptom that might appear innocuous initially: a persistent change in bowel habits. We're not referring to occasional variations. Rather, we're addressing a sudden and enduring alteration in the frequency, consistency, or size of your bowel movements. If this rings a bell, it's imperative to take notice. Your body could be signaling that there's a more profound issue unfolding in your digestive system. For instance, if you've been experiencing regular constipation and suddenly switched to persistent diarrhea, or vice versa, this could be a significant indicator. Similarly, a noticeable change in stool color, such as consistently dark or bloody stools, could also be a cause for concern. Paying heed to these shifts can provide valuable insights into potential underlying health issues. Moving on to the next item on our list, we encounter a symptom that frequently triggers immediate concern: the presence of blood in your stool. Regardless of whether the blood appears bright red or has a darker hue, rectal bleeding can be a sign of various conditions, with colorectal cancer standing out as a potential concern. If you've observed this symptom, it's crucial to promptly schedule an appointment with your healthcare professional. Early intervention can play a pivotal role and significantly impact the overall outcome. For example, consistent bright red blood in the stool, especially when accompanied by other concerning symptoms, or dark, tarry stools that indicate upper gastrointestinal bleeding, should be addressed promptly to ensure appropriate diagnosis and management. Proceeding to our third pivotal symptom, unexplained weight loss. While shedding pounds is a common aspiration for many, when it occurs unintentionally and swiftly, it becomes a matter of significant concern. This may be your body signaling an underlying health issue, potentially involving colon cancer. If you discover yourself losing weight without any corresponding changes in your diet or exercise routine, it's imperative to seek guidance from a healthcare professional to ascertain the cause. For instance, if you notice a substantial and unexplained drop in weight within a relatively short period, such as 10 pounds or more in a few weeks, this could be indicative of an underlying health problem. Additionally, if your weight loss is accompanied by other concerning symptoms like fatigue, appetite changes, or persistent pain, it further underscores the importance of seeking prompt medical attention. Continuing our exploration of these symptoms, our next destination is persistent abdominal discomfort, encompassing cramps, gas, or lingering pain. Avoid dismissing these sensations as mere indigestion, as they could be subtle yet critical indicators of an issue within your digestive system, potentially linked to your colon. It is imperative to seek medical advice to rule out potential problems if you are contending with persistent discomfort that shows no signs of improvement. For example, persistent abdominal cramps that are not alleviated with over-the-counter remedies or changes in dietary habits may warrant further investigation. Likewise, recurring gas or bloating that persists despite adjustments to your diet could be indicative of an underlying gastrointestinal issue that requires attention. Addressing these symptoms promptly is essential to identify and manage any potential digestive health concerns. Now, turning our attention to our 5th critical symptom, experiencing a constant feeling of fatigue or weakness. While fatigue is a common complaint, persistent and unexplained exhaustion may serve as your body's signal of an underlying health concern, potentially indicating the presence of colon cancer. If you continually feel tired despite getting adequate rest, it is crucial to engage in a conversation with your healthcare professional for a thorough evaluation. For instance, if you find yourself consistently fatigued to the extent that it interferes with your daily activities, or if weakness persists even after taking measures to address sleep and lifestyle factors, it may be indicative of an underlying medical issue. Additionally, if fatigue is accompanied by other concerning symptoms, such as unintentional weight loss or changes in bowel habits, it further emphasizes the need for a comprehensive medical assessment. Addressing these signs promptly can contribute to early detection and effective management. Advancing further, our sixth symptom is iron deficiency anemia. This condition is distinguished by a low red blood cell count stemming from inadequate iron levels, and chronic bleeding in the colon can contribute to this deficiency. Indications such as weakness, pale skin, or shortness of breath should not be disregarded. Recognizing and addressing the underlying cause is vital, underscoring the importance of a thorough evaluation. For example, if you notice persistent fatigue and weakness, accompanied by symptoms like paleness, especially in the face and palms, it could be indicative of iron deficiency anemia. Similarly, experiencing shortness of breath with minimal exertion, known as exertional dyspnea, may be linked to reduced oxygen carrying capacity due to low red blood cell levels. These signs warrant prompt medical attention to identify and address the underlying cause, as they can be associated with various health conditions, including those affecting the colon. Our seventh crucial symptom involves a subtle observation that may not trigger immediate concern: the consistent presence of narrow or pencil-thin stools. This could potentially indicate an obstruction in the colon. While several factors can influence changes in stool size, a persistent narrowing pattern could be a significant signal that demands further exploration. If you notice this symptom, seeking consultation with your healthcare professional for a comprehensive examination and appropriate tests is paramount. For instance, consistently passing stools that resemble thin pencils, especially if this is a departure from your usual bowel habits, may suggest an obstruction or narrowing of the colon. This narrowing could be due to various reasons, including the presence of a tumor or other structural abnormalities. It is crucial to address this symptom promptly to determine the underlying cause and initiate appropriate interventions, if necessary, to ensure optimal digestive health. As we conclude our discussion, the final crucial symptom to consider is the persistent sensation of incomplete bowel emptying. If you consistently feel the need to return to the bathroom shortly after use, it might indicate an issue with this sensation deserves thoughtful attention, as it could be associated with various conditions, including colorectal concerns. If you find yourself grappling with this persistent feeling, it's essential to reach out to your healthcare professional for a thorough and comprehensive evaluation. For instance, if you regularly experience the sensation of not fully emptying your bowels and find yourself returning to the bathroom shortly after, it could be indicative of issues like rectal prolapse, muscle dysfunction, or other colorectal disorders. Addressing this symptom promptly is crucial to identify the root cause and initiate appropriate interventions, ensuring optimal colorectal health. Remember, seeking guidance from your healthcare professional provides reassurance and helps navigate any concerns with expert care. In conclusion, being aware of these 8 critical colon cancer symptoms is not just about knowledge. It's about taking control of your health. If you or someone you know experiences any of these signs, don't hesitate to seek medical advice. Early detection can make a significant difference in the outcome. If you found this information valuable, please give this video a thumbs up, share it with your loved ones, and subscribe for more health-related content.